Go ahead.
A very good evening. Today is 5th September, and the topic for today is awareness about fertility treatments. First of all, I wish everyone happy Teachers' Day. Teachers are the one in our lives who increase awareness of us, increase our knowledge, and bring us to this world with all sorts of knowledge and help in developing our attitude and aptitude. I feel this is important as each new thing which comes to us, we require knowledge about it. And so, today, on the occasion of Teachers' Day, I would like to increase awareness among infertility patients and raise the awareness regarding the fertility treatment options available with us. So, friends, we have lots of options available in this 21st century when it comes to infertility. But each and every option wouldn't be applicable for each and every patient. So, a patient centered approach is what is recommended by all of us. First, we need to find the cause of infertility. And if we categorize this into three important causes, it can be male factor, it can be female factor infertility, or it can be combined. It is both problems having together. Along with that, 10% of the causes can be unexplained infertility. In male factor infertility, we have sexual dysfunction, we have uh, hypothalamic pituitary causes, pre-testicular, testicular, and post-testicular problems. These all problems can be there and can pose a problem in front of the men to get pregnant, to get fertile. So, second is the causes in the females, and here it again can be categorized into three important categories: tubal factors, ovarian factors, uterine causes, which also includes cervical causes. The treatment will be according to each of these. Then there can be combined causes, like there can be some problem in the uh, wife, some problem in the husband, and this can cause the problem overall to rise. Along with that, there can be certain areas where no cause is found, which the tests which are done routinely are not able to find any obvious cause in the man or woman. This is labeled as unexplained infertility. It doesn't mean that they don't have any problem. It just means that it is not being evaluated by the routinely done tests. So, friends, what are the options in fertility treatment available? That's an important question. So, it depends upon the problem of the patient. It has to be identified and addressed. If we find a specific cause in a man or a woman, can we treat that specific cause is the important question. If we are able to treat that specific cause, then the fertility treatment can occur, that the conception can occur spontaneously. Suppose a man has low sperm count, and the reason for that low sperm count is found out to be presence of dilated veins around the testis, which is called as varicocele. So this can cause problems with the semen count, and therefore the treating the varicocele by surgical correction, that is varicocelectomy, sometimes helps, and the sperm count can improve on its own, and the patient is able to conceive. Like this, finding the cause is very important. In a woman, if there is problem in the cervix and there is some cervical stenosis, or there is some cervical mucus hostility because of which the sperms are not able to negotiate the cervix and go inside, in these patients, a simple IUI can help, where we bypass the cervix and go inside and deposit the sperms in the uterus. That is called as intrauterine insemination of sperms. So therefore, finding the cause is very, very important. Now we come to the methodical treatments of fertility which are available. Friends, as we saw, that treating the cause is very important. Sometimes treating male subfertility is very important. Sometimes treating female subfertility is very important. Now we come to certain treatments where the treatment of uh, subfertility can be increased by these. So one form of treatment is ovulation induction. So ovulation induction can be done by certain medications. We give these medications so that the Ovaries are stimulated to produce one or two eggs, and the couple is advised to have a normal relationship on in the periovulatory period. This is the basic form of treatment, and the success rate slightly goes up than the natural try. Along with this, we can advise sometimes what is called as timed intercourse or timing the intercourse activity related to the ovulation. Nowadays, we advise that timed intercourse should not be very strict so that the couple gets the stress of having the contact on that particular day. Alternate day contact can be recommended when it comes to ovulation induction treatment. Along with this treatment, we can give certain medications to increase the fertility status of a patient. So this can be folic acid, vitamin D, vitamin B12, antioxidants in both men and women. Sometimes vitamin D, vitamin E also help to increase the fertility levels. If all this doesn't help and the patient doesn't respond to the first line of treatment, then we can plan something called as intrauterine insemination or IUI treatments for these patients. So IUI is an important form of treatment where there are cervical factor infertility, mild male factor infertility, problems with the ovulation, anovulatory cycles, and so on. So IUI is direct deposition of the washed sperms inside the uterus, and this is going to be very time specific. So once the ovulation is triggered, approximately 36 to 40 hours after the trigger, the sperms are introduced inside the uterine cavity so that the timing of ovulation and the timing of the sperms reaching inside will be matched, and therefore there can be increased success. Along with this, the cervical factor is also treated in this. Male subfertility, if there's some minor issues with the sperm count, motility, these are also quite well treated with the IUI treatments. Now, these IUI treatments have certain limitations, and therefore, single IUI treatment won't be sufficient to treat a couple, and therefore, we have to plan number of cycles, that is 3 or 4 cycles at least, to have an optimum result when it comes to IUI. If it is unexplained infertility and even after 4 cycles you are not able to conceive, we might think of changing the treatment plan. Suppose there is sexual dysfunction or ovulatory dysfunction in these patients, more number of IUI cycles can even be considered. Sometimes there is IUI may not be possible because of vaginismus or certain other problems. In these patients, intravaginal insemination can also be done, or else IUI under anesthesia can also be tried. IUI with donor sperms can be indicated in men where there is azoospermia, and this azoospermia usually is non-obstructive azoospermia. Sometimes men who have obstructive azoospermia but don't want to go for testicular sperm aspiration, in these men also this form of treatment can be useful. Next level of treatment is IVF treatment and other advanced IVF treatments. So it can be IVF, ICSI or ICS, intracytoplasmic sperm injection, or ICSI with frozen embryo transfers, ICSI with pre-implantation genetic testing, and so on. So multiple options are available. Those uh, couple who have minor issues and uh, their sperm count is okay, the egg count is okay, in these patients, the normal IVF can help and suffice to have a good embryo. But in those couples where the egg count is drastically reduced and if the sperm count is drastically reduced, then intracytoplasmic sperm injection is the preferred mode of treatment for these couples, because this will help to for the fertilization more, and that there are less chances of fertilization failure as against IVF. After ICSI, we can grow the embryo for day 3 or day 5, and blastocyst culture or day 5 culture is importantly giving more good results these days, and therefore that forms another form of therapy. Freezing the embryos is the next level of treatment, or the form of treatment where the success rates are going to be high. So that's about it. What else do we have? Sometimes there are multiple IUI failures, multiple IVF failures, recurrent pregnancy losses, or certain genetic problems in the couple. In these cases, we can do a pre-implantation genetic testing of the embryo. So even before putting the embryo inside the womb, we can genetically assess that embryo and then put it inside the uterus. This is called as pre-implantation genetic testing (PGT), and this can be done for a variety of genetic disorders in the couple. After doing PGT, only a euploid or chromosomally normal embryo can be put inside the cavity so that we have good results. Endometrial receptivity array is another form of treatment where there is multiple IVF failures and the endometrium is not receptive. So we find out what is the exact time of doing embryo transfer, and personalized embryo transfer can be done, and the success rates of IVF can be increased. Along with this, immunotherapies such as intravenous immunoglobulins, intralipids, and so on can help in increasing the success rates of IVF where there is no obvious cause found for the recurrent IVF failures. Thin endometrium can pose problems in the fertility treatments. Therefore, there are a variety of treatments available to deal with the thin endometrium, such as the operative hysteroscopy, estrogen treatment, aspirin, low molecular weight heparin, vitamin E, uh, injection GCSF, PRP, and so on. So there are multiple options available. For those couples who have drastically reduced the sperm count or egg count, in these cases, uh, intra-ovarian or intratesticular PRP injections or stem cell injections can be tried to increase the egg count and the sperm count. The success rates of these treatments remain, however, low, and these are patient specific. Some patients do get benefit from this, but some may not. And this is not a validated treatment as of now, but it's considered as an experimental therapy in many patients. Another forms of fertility treatments are which is called as the IVM, in vitro maturation, where we get immature oocytes, we can mature them outside the body and then utilize them for ICSI. So these techniques are also available with us. We have certain patients in whom menopause is already reached and the ovarian reserve has extinguished. In these couples where there is a premature ovarian failure or premature ovarian insufficiency, in these couples we have option of adopting a donor oocyte for doing ICSI. In those couples who have azoospermia, the husband has azoospermia and it is a non-obstructive azoospermia, we have certain thing called as microsurgical testicular sperm extraction, where under a microscope the sperms are removed from the testis, and this is helpful in many cases. In those cases where there is non-obstructive azoospermia and that sperms cannot be found by testicular biopsy or microsurgical test, in these couples we can use donor sperms as an alternative form of treatment. So, friends, infertility treatments comes with a variety of baskets. We have to utilize whatever is best for one single patient. We cannot utilize the advanced form of therapy for just a small cause. So, therefore, all forms of therapies which I discussed may not be applicable for each and every patient. Finding the appropriate cause is very, very important. Treating the patient as an individual is very important. We cannot have a blanket treatment for all patients. Analyzing each patient separately, analyzing each patient's cause separately, and then going on for a treatment is a very important aspect of therapy when it comes to fertility treatment. And Dr. Nilesh Balkawade at Oasis Fertility, I usually follow this specific approach of a patient-centered or a patient-specific approach in fertility treatment. That's very important when it comes to fertility. So friends, I hope my message to you regarding these fertility treatments is loud and clear. Any of your queries which remains unanswered can be answered now, or else you can contact our helpline number which is shown below. We have two centers in Pune: Oasis Fertility at Dynasty Commercial, Wakad, and Oasis Fertility at Kharadi, Arisa Avenue. So you can reach out to us physically, or you can contact us virtually on phone, and your queries regarding fertility treatments can be answered. I think this is a spam message. Yeah. So the question is, why is it important to be aware of infertility? I feel infertility is problem not only for the couple, but for the family who is also stressed out of it. There is not only a problem within the family, it can be a societal problem as well. There is associated uh, taboo when it comes to infertility in India. In spite of being in the 21st century, a woman is considered as a problem for not having a child, and the problem with the men are not considered. This is by large a societal problem, and therefore, addressing this issue becomes very, very important. So, um, awareness of infertility and its treatments will bring the cases of infertility to a lower level, and we can have maximum couples seeking treatment with us, and can help we can help them. Next, what are the benefits of infertility treatments? So basically we have uh, these treatments are benefiting patients in a variety of ways. They can have the time to pregnancy can be less. Sometimes the couple is able to conceive most of the times in first year of marriage or the first year of the trial. Couples are able to conceive in 2 years of trial naturally. At least 70 to 80% can conceive. Almost 80 to 90% of the couples can conceive within 3 years of their marriage. But if they are not able to conceive, then the time to pregnancy is increasing. And if there is late marriage, then the couples can have certain problems such as ovarian insufficiency or decreased ovarian reserve, or problems with the sperm analysis. So in these patients, treatment becomes necessary so that the time to pregnancy is reduced. And this is very important so that the gametes remain normal, and the expected results can be achieved faster. Therefore, infertility treatments would be definitely useful. Different reproductive techniques. Why is reproductive technology important? Different reproductive techniques help to reduce the time to pregnancy, as I just discussed. And those couples who have extreme problems, like very difficult issues to tackle, this can be addressed via ART techniques. And we have different ART techniques such as IUI, IVF, and so on. And therefore, these techniques are important in achieving success where the problems are pretty huge. Next, please. Why is IVF an ethical issue? I don't consider IVF an ethical issue because there's people have become very progressive about their thought process, and I don't think this question generally arises. What are the social implications of IVF? I feel there is still some amount of mixed feelings about IVF. Some patients may just consider it a taboo, but I think that's decreasing, and more people are now accepting IVF as a standard treatment, and it can be definitely be very helpful when it comes to treatment. Next. Thank you so much for being there, and any of your queries we'll be happy to answer on the below given helpline number. Thank you. We'll be having this fertility awareness campaign every Monday in our next FB Live. If you like this FB Live, do like and share it with those who need it. Thank you.